Welcome to this edition of A Healthy You. Today we are talking about malaria. Insects have been around for millions of years, and many of them carry parasite diseases that are deadly to mankind. Malaria is one such disease. Malaria is an infection of the blood by a parasite that is carried from person to person by mosquitoes. Worldwide, malaria causes 250 million illnesses and more than 1 million deaths annually. Malaria is most common in tropical climates, but is particularly devastating in Africa, where it kills a child every 30 seconds. Malaria is transmitted via the female Anopheles mosquito. When a mosquito bites an infected person, it ingests the malaria parasites found in that person's blood and then transmits it to the next person. Malaria can lie dormant for years and can recur time and again. Malaria's recurring nature can weaken the body and become quite unbearable. The first symptoms are very similar to flu: aches and pains, fever, headache, nausea, vomiting and diarrhea. After a few days, the typical outburst may occur: chills, followed by a high fever for a few hours, and then by profuse sweating and disorientation. Between these outbursts, the patient may feel well. The liver and spleen become enlarged, causing anemia and jaundice, where the skin and eyes become yellow. Malaria is dangerous for pregnant women and the unborn child, who can develop the more severe form of the disease, resulting in delirium, coma, and death. The various medications available can easily treat the different forms of malaria, but may not necessarily taste very nice and may have side effects. However, it is very important for patients to stick to their course of treatment, as malaria can cause fatal complications if the diagnosis and treatment are delayed. The only effective way to prevent malaria is to learn about the risks and symptoms of the disease, and so prevent the mosquito bites in the first place. Travelers to malaria areas can take anti-malaria drugs, and people living in malaria areas can easily protect themselves. Mosquitoes are most active between sunset and sunrise, so apply mosquito repellents to the skin and use insecticidal sprays, vaporization mats, or mosquito coils inside the home. Use screens on windows and doors. Sleep under a mosquito net, preferably soaked in insecticide, and wear long clothing to minimize the amount of exposed skin. Strong fan currents and white areas of clothing are also effective in disturbing mosquito feeding. Be proactive against malaria. The easy preventative measures are as important as taking medicine to prevent malaria. Identify malaria early. Get tested and treat it immediately.